Today we're going to walk through a clinical note using Aprima's dashboard. As you can see here, we've got patient Aldo Follensby on screen. This is kind of the starting point. So we see first all of that patient information, kind of the background. Look to the left side here. We have a navigation menu that will take me to any element of the clinical note. And that ties directly to what we see on screen here, where we either consume information or do documentation. So let's get started. As I move down, notice that the top of the screen resets. Gives me lots more real estate so that easy to move about. Now we begin with the patient story. And the patient story is a great place to capture, like you see here, a little bit of information about the patient's background. And we have a younger patient here, so really ideal for that. Or maybe in the example of an older patient, maybe how that patient got to their point in their life. We've seen that pretty commonly. Some of my physicians who work in a care team type of format will often articulate their plan here so that as other members of the care team access the clinical note, they have an easy way to kind of be brought up to speed. And moving down, activity since last visit, we see here the callouts in orange tell me anything that has occurred since the last time we saw the patient. And that's the last clinical encounter. So as you can see, there's been a number of messages, a couple of labs that have come in, medications, and so forth. Moving down to the problem list, and just that navigation is so nice. This shows, of course, the problem list, which can be filtered based on provider preference. This is where I can add in easily diagnosis. HCC is displayed per diagnosis and would be totaled here at the very top. And of course, this is a younger patient, so not seeing anything in that regard. Next space down is what we call a disease-specific panel. And what this is, the patient has a disease that falls within the defined range, or an ICD-10 to be more specific. And so what we see here are observations that ideally give us disease status, a couple of which are high, they're out of range. So a little bit of backstory, this is simply onset as an adult. Regarding plan, it's noted really in the care plan down below. And as we can see here with the goals, we're going to bring down total cholesterol and LDL within normal range. We're using medication and healthy eating choices to address that. And of course, so far the outcome is a trend downward in both total cholesterol and LDL. Okay, let's move on to the med list. So med list is populated here. This can be pulled in from SureScripts. So SureScripts provides that wonderful download, ability to select each medication that you want to population of the patient's record. I can certainly prescribe from here, which we're going to do in just a little bit. And of course, all the drug reconciliation, screening, and so forth goes on as we prescribe a medication. Now, looking to the menu to the left, you can see here the balance of items as we move downward. What I'm going to do now is actually document a clinical note. So this is ideal for anyone who is using narrative as kind of their primary means of documenting. So typing or talking, I'm using voice recognition software here, Dolby's Fusion Narrate to be more specific. And we're going to do subjective, objective, and plan, prescribe a medication, do an order, and then let's take a look at the finished progress note. Okay, so from here, simply go into do the first part of the note, the subjective piece here. So let's go ahead and record. The patient is a pleasant 50-year-old male who presents today with a complaint of low back pain, period. This is an intermittent and recurring issue that was recently exacerbated when helping his son move into his dormitory last weekend, period. He indicates he has difficulty becoming ambulatory, especially after periods of inactivity, period. On a pain scale of 1 to 10, he indicates his current pain level is a 7, period. Save. So driving by voice, not only did I articulate the voice segment there, but I'm using voice commands also to do my save and kind of work through the note that way. So let's move on to the objective. My physical exam. And as you can see, the voice command brings up my physical exam. So we're going to navigate down here to musculoskeletal, just like so, and articulate the positives. Spine colon, decreased flexion comma, decreased extension comma, decreased lateral bending comma, and decreased rotation period. Normal gait and station period. All set. Save. Very good. So let's go ahead and kind of move back up the list here. I'm going to go back up to my problem list, data diagnosis, low back pain, and you can see that the verbal query brings back matching ICD codes. We're going to select the top one here and add that to the list. Now what I'm going to do is put an order in with this. So I'm touching on low back pain. We're going to do a new order. And let's move down the list here just a little bit. X-ray exam of the lower spine. And save that. Now I'm going to articulate the plan. I have advised the patient to apply heat to his back, which he may use as often as possible, period. A prescription for naproxen, 375 milligrams, has been sent to the patient's pharmacy, period. An X-ray of the lower spine has been ordered, and a 2-week follow-up has been requested, period. Save. All right, let's finish up here. I'm going to go to the med list. Let's prescribe. Naproxen. Now the very top item here happens to be what we call the default SIG. It's in my favorites list. It's something I prescribe with frequency, so I have a pre-written SIG ready to go. Let's just touch on that real quick. So from here you can see, take 1 tablet orally, 2 times daily, and 10-day supply. Okay. Now this will go to the pharmacies of the patient's choosing. Also, make sure that we have our diagnosis in here as well. And we'll go ahead and save that prescription. Okay. Well, let's get down here to the very bottom and view the output. As you can see, real nice, clean progress note comes together here. And what makes this nice is that a progress note like this can easily be sent out. So as I close the clinical note out as a completed note signing off, in the background, we can automatically send a copy of this to a referring physician, or if I need to send as a consult type of letter, it'll go as direct mail or fax, depending on how the recipient can receive the document. So some real nice automation that's built in as we close out the note. All right, thanks for joining.